Probably the biggest change that we've had over the past couple years is the blurring of the line between acute or attack treatment and preventive treatment. So I think anybody who takes care of patients with migraines is very used to this repetitive discussion about this is a prevention medicine, you have to take it all the time, but it won't work yet. And this is an attack medicine, and you can only take it so many times in a month, or it could make things worse. And it's just ad nauseum, every new drug that comes out for a long time, that's been true. And so it's really, again, just over the past few years that we have a few treatments that are FDA approved for both attack and preventive therapy, and give us the ability to give some patients really what they've been asking for, which is something they can take when they have a migraine, and then they can use it more if they have more migraines without there having to be this whole different arm of therapy. So the two big, there's a couple devices, but one of the big events over the last year was the approval of the Nerivio device, which is a remote electronic neuromodulator for migraine prevention. So it's been on the market for attack therapy for a while, but it just received FDA approval as a preventive therapy this year. I was lucky enough to be a part of one of the studies really recently looking at the long-term safety and efficacy of this device, and just really underscoring that it looks like a good preventer. It tends to, for people for whom it works, it tends to reduce symptoms over the long term, over the course of month over month over month out to a year. So that quality of a preventive medicine is really important. And the lack of tachyphylaxis that we saw in that group of patients was reassuring. So, we have a group of patients who find that helpful for their migraine attacks. And now we can say, well, there are now 18 treatments in each Nerivio device. And so they can use that every other day during periods of increased headache frequency or severity. And then they can kind of revert back to as needed treatment when that's more appropriate. And patients love the ability to be in control of their treatment. I think that's why a lot of patients who have migraine don't want to come in, because they'll say, I have my Excedrin and I have my ibuprofen and I, snorkel in a bucket of ice with a cup of coffee sometimes. And, they just sort of manage it by themselves for so long. It can be uncomfortable then to go see somebody. And now I have to say what I'm doing, and I have to, track how much medication I'm taking. So for these drugs that and treatments that have this like flexible strategy, it seems to really help patients who don't like to give up that level of control. The other one that's been on the market for a while is Nurtec. So rimegepant is a CGRP, small molecule receptor antagonist, and rimegepant or Nurtec has been on the market for abortive therapy and then had a secondary FDA approval for preventive therapy. And it's kind of same idea. You take it when you get a migraine, and then when it's had like around the holidays, I'm going to see my difficult family member, or I know I'm going to be eating things that family made and there may be triggers in there that I can't avoid. Then you can kind of flex into, well, I'm going to take this more frequently for a while and not be afraid that it's actually going to make my disorder worse. So that, as a physician, talking to patients and trying to help them feel comfortable and motivated to do what they need to do for their health, that kind of a blurring of the lines has been really wonderful.